Perhaps I can ask Professor Whitty, in his capacity as an advisor to the government, did SAGE give advice to the government on the target of the 100,000 tests a day?
Well, SAGE would not give. SAGE did not give that specific target. SAGE has consistently said, and indeed I have consistently said, that one of the things we needed to do was have a greater capacity to test across the whole of the UK, and that's, I'm glad to say, now happening. So the aim to increase it would absolutely be joined not just by SAGE, but to be clear, by all public health bodies and all ministers. And I don't think that there's really much difference there. So I think that the main questions on that one were operational. How fast could this increase happen? But the actual number was not a specific number recommended by SAGE specifically, but the general trend of it, absolutely. SAGE thinks there are quite a lot of things to be done with testing, and that therefore increasing it is very important for several reasons.
Does SAGE have a view as to what the volume of testing should be? There's obviously an interaction between what is desirable and what is operationally possible. How is that discussion reflected?
So SAGE has a view, is in fact developing a view at the moment about what the optimal maximum amount of antigen testing and indeed antibody testing. Those are different answers. I can expand on that if you like, under a number of different scenarios. But there's a base case that everybody agrees that has to be done, which includes allowing critical workers to be tested, certainly includes greater testing within hospitals for people who don't currently have symptoms, for example, people who might be coming in for elective things, and greater testing in care homes. And what we're trying to do is get that basic number and then also build on top of that, what are the other things that we could use it for under a number of different ways of running the next stage of the epidemic, which is going to be a prolonged one, and therefore giving advice to all four nations, but the UK as a whole, about what they think broadly the numbers might end up looking like if we could get to an optimal number. But we have not yet got to the point where we've finally got a number on that.